Hi there, and welcome to the Sheer Recovery Podcast. I'm your host, Anthony Valanos, and we're brought to you today on iHeart, Spotify, and YouTube. So tune in whenever and wherever is convenient for you, but we certainly hope you check out the show. We've got a special guest today, Dr. Howard Fox. Dr. Fox is an expert chiropractor. He's got over 30 years experience, and he's on the show today. Welcome, Dr. Fox.
Thanks, Anthony. Pleasure to be here.
Absolutely. Doc, you know, we are a recovery podcast. We love to talk about recovery, and you're a chiropractor. So our audience is probably wondering, how do these things come together? And before we talk too much about recovery, I like to talk about chiropractic. Well, why is it that you started in chiropractic? You're an industry leader. I mean, what is it that gave you the passion?
Oh, I got the passion the hard way. I was learning to do flip dismounts as a gymnast, missed, landed on my neck, and went to the hospital. Oof. Simple as that. I left the hospital a couple of weeks later, happily able to move my arms, but still couldn't look up.
Oof.
My mom was a ER nurse and kind of fought the chiropractic urge my dad was sending me in to do, and finally just gave in because they started talking about cutting pieces off of my body. Oof. At 10 years old.
10?
Yeah, 10. And then we went in to see Dr. Scott Lawrence, and he adjusted my neck, and I was moving around in a week.
So non-surgery, a chiropractor is able to put you back together and help you to where you didn't need all of this pain medication, all these other issues, and it was like a miracle for you.
No meds. I competed in every form of sports I can think of, soccer, wrestling, lacrosse, hockey.
Wow.
Throughout my life. I continue to compete actively in several sports, and I help others do just that, and that was why I wanted to do it.
Nice. So you got educated, you followed your passion, started helping people, opened your own practice. How is it that being a chiropractor and helping people with injury, I mean, just full disclosure, Dr. Fox is, he provides ancillary services at Sheer Recovery. So we're very familiar with all the things you do and how you've been able to help our clients. But to our audience, how is it that chiropractor helps recovery from your perspective?
We start off simply with treating pain issues. When you stop taking all the pain meds that you've been prescribed and are addicted to, you still often have the pain because the mechanical functions of the injury were never treated.
Right.
So that's how we got involved in treating recovery patients. And then things changed. And we enjoyed it. It was actually very rewarding to see people go from barely able to function, never having actually had mechanical things treated, disc injuries, shoulder injuries, knee injuries. Guys were doubled over, and they were just being given drugs to cover up the pain.
Right.
So when we saw those things change, it was great. And it was really rewarding. However, we started using a couple of techniques that you're aware of. One's the SCA technique. That is a global pain management tool. It's been around for 15 years. It's well documented, well researched in its pain function. And it's really an effective tool. However, we started to get a very unusual side effect, which was alcoholics in particular and opiate users were coming up to us and saying, "Doc, I have not slept in months, years, decades, and after 2 or 3 treatments, all of a sudden I'm sleeping." And I thought, that's weird.
Yeah, that's an eye-opener. I mean, you stumbled upon a solution, a side effect, a positive side effect of a therapy that you are using for pain management, and it turns out it has other benefits, like it's able to help you sleep, and it's SCA, I forget the acronym, but it's a scientific word, and Doc's more familiar than I am, but, you know, being able to repair your serotonin levels, your dopamine levels, I guess what you're pointing out here is, just because you go to rehab and get sober doesn't solve everything. And a lot of these guys are men and women, they're in pain management clinics, they've got all these other issues. So you pull the drugs away and the pain remains. Sometimes you don't even know what pain you're actually in until you take the drugs away. If you've been on opiates or any prescription for 5 or 10 years, your body may have recovered somewhat, and it also still may need some attention. So this happens a lot, not just with musculoskeletal things. That's one that you're obviously right there to fix. Sometimes some of our clients don't have teeth. Maybe they've been using methamphetamine. They need to see a dentist. So there's all these ancillary services, and at Sheer Recovery, at least, and a lot of centers that offer chiropractor, acupuncture, a lot of ancillary services to help the body and mind and soul and spirit kind of really come in harmony and recover fully. It's been a huge benefit to us. And then you started the SCA treatment. And now, are you connected with a study, or how is it that you started doing this treatment?
Well, we like I said, we got people who were just giving us reports. Then we started using psychological questionnaires that were based on serotonin functions. They give you insight into serotonin levels. They give you insight into dopamine levels, and they give you insight into gabapentin levels, which are neurochemicals that are produced in the brain specifically for the brain. They're not produced in the rest of the body and used in the brain. So what happens in the brain stays in the brain. GABA is kind of the calming agent that allows you to rest and be at peace. Serotonin is more of a moment-to-moment happiness. I smell a pretty flower and I think, oh, that's awesome. And I get a little smile on my face, get a little surge of serotonin. Dopamine has a lot of functions in the human body, one of which is that ability to project long-term that there's some hopefulness out there in the universe, and I have an uplink going on that I could relate to the rest of the world. Without it, we get really into states of depression, and that's what a lot of depression medications end up treating. So when you see a patient who's used antidepressive medications, particularly SSRIs, that's what you're trying to do. You're trying to get the function of serotonin and dopamine in the synapse for a longer period of time because production has dropped down. In drug addiction, particularly opiate addicts, you get significant loss of production in serotonin and dopamine, or you get an effect on the receptors that can sense serotonin and dopamine, because when you're taking something like heroin, it's a synthetic. It's 100 times more powerful than your body's natural production of serotonin or dopamine.
Right.
So naturally, your body thinks, hey, I've got plenty. Right. I'll stop making it. Oops, then I need more of the drugs, and that's the cycle of addiction. It's one of the components of addiction that we found that using the somatic evoked activation, that's that big SEA word, that is what that affects. Right. And we went back after getting questionnaires back that looked really positive, and we looked at the original pain research, which was done in the 90s and early 2000s, and lo and behold, they were tracking serotonin, dopa, GABA, and they were doing endogenous opiates, your body's own natural opiates.
Right.
And they saw elevation and regulation of those produced elements. So we've hypothesized that this would continue in the drug-addicted population, and from our questionnaires that we've studied now for 2 years, it certainly looks like it. It's a little hard to test. You can't test blood production because what's made in the brain stays in the brain. The only way to track it is to really look at function, and now we've come up with a technique called functional MRI, which is what our next phase is. So we are on phase 3 of our research, and that will be participating on a university level to evaluate patients right after they come out of their first phase of recovery, which is detoxification.
Right.
We'll pick them up from there. We're going to use functional imaging to look at their brains in activity levels.
Okay.
And then after 6 to 8 weeks of treatment, 3 times a week for half an hour every time, along with their therapy, and then we'll use a control group that we're not going to give SEA to.
Right. So you're taking your phase 1 and you're saying that we can do brain imaging, functional brain imaging.
Correct.
To be more accurate?
Yes, we'll be much more accurate. Right now, what we know is that 30%, roughly, a little more actually, improvement in patients completing the care they enter recovery to complete. So they stay in the program better because they're sleeping better, their cravings are down, and they just get a better sense of, hey, there's a future for me. I'm not just stuck in this rut. Obviously, nothing that we're doing it's in and of itself anything. It's a tool that companies like yourself use.
Right.
And that's all it is.
So there's still no magic cure for addiction.
I don't have a magic bullet for you. Sorry.
Okay, we're looking for that one.
I don't have that. I have another tool for you to use.
I think that the idea is with recovery, and we always stress this in admissions and talking with clients when they come in, is that, look, this is your choice, and you've got to want it. We can only help you. And by help, I mean providing tools and support to make it easy. You don't need to do it
without lifestyle modification and understanding how to live a life that's not drug-centered. Anything I would do to help somebody would be a waste of time.
Well, but if you have the focus and you want to get better, and you've got a doctor helping you get through detox, and then you've got a chiropractor helping you deal with pain and the SCA and these different techniques, you give yourself every opportunity.
Absolutely. And again, more opportunity, more tools to get there is what we're all about. But like I said, our next phase is going to be very interesting. It's university-based. That's why we're in COVID land right now. So we are on hold. We actually just got funded $200,000 to do this study, and we have participation with a large university, but right now you can't bring any patients to the university. So we're kind of on hold.
How is it going to be once the global pandemic passes? Is there an opportunity for people to participate in the study?
Our office in San Juan Capistrano, California, allows patients who are in a state of recovery already, who want to get away from dependence on medications that they've been given in recovery sometimes and reduce those down. We coordinate with their psychiatrist to titrate patients down. We try not to say we're getting you to zero because that's usually not that easy. Mm-hmm. But to bring the levels down, we are very effective at doing that, working with the psychiatrists hand in hand at doing that. We are available in San Juan for people who are in the region, Southern California. We get them from San Diego, Long Beach, as far as LA, come down. And then we have a home unit for the electrical device that is in production but not available quite yet.
I see.
So the units are electrically based. I should have brought you one here today.
Well, I've seen it, but it's not very invasive.
It's non-invasive.
I think, is it, and I'm forgetting, it was several months ago, I was there with you and the patient. It's electrodes. Maybe tell our audience, give them a picture of what the treatment is like, and it's not painful or anything like that.
No, there is no pain. As a matter of fact, it's an anesthetic. Remember, it's a pain treatment.
Right.
So pain drops away as you're using it. Most people are completely comfortable, and they have total control. You control the amount of amplitude, which is the amount of energy that goes in, mm-hmm. and it is an electrical device. If you've seen a TENS unit or anything of that nature, you connect pads. We have specific locations that are geared to getting the electrical signal up into the base of your brain. It goes up your brainstem, into your thalamus, and then loops back around. Those are the areas where all of those neurochemicals are produced. In stimulating it, we use specific frequencies, and that's what we've done. We've come up with what frequencies do this.
Nice.
And we've pre-programmed them, and it's just a matter of the patient does it to tolerance. So they control the volume of juice going in, mm-hmm. but we've set the frequencies.
I see. So it's not hocus pocus. This is all science-driven, and it's providing positive outcomes. There are some side effects or at-risk clients.
Oh.
The LSD, I think, is just an interesting one because I'd never heard of this. It can trigger.
So we had in our first group we did, and we did 2 of them, and that was the last 2 we're doing. We had it actively trace the memory of the trip. Mm-hmm. So we literally had people tripping on a table, which was not what we were trying for. We've abated people who are heavy acid users. We really just don't work with them.
Right.
Obviously, people who have issues with electrical conductivity, seizures, things of that nature, we don't want to work with those right. patients. We don't know if there's a risk. We also don't want to find out
right.
if there's a risk.
Yeah.
And then we don't work so much with people who we've seen in our early studies. It's just not effective because nothing works on anything. There is no panacea out here. I just don't have that for you.
Sure.
So our heavy cocaine user is not that well benefited from this particular application.
Mostly opiate addiction, alcohol, any benzodiazepine have you worked with?
Yeah, benzodiazepine, methamphetamine, effective, not as effective as alcohol and opiates. Those are the stars of this particular tool.
Right. Well, we've been really just super proud and excited to have you and the work you've done at the center and in the community. I mean, Sheer Recovery is not the only center you work with, but you've found a path to be impactful in recovery.
I actually just got a call from one of your clients.
Yeah?
Yeah.
Don't mention the name, please. HIPAA
Okay.
and that.
I'm not going to mention the person's real name at all. I can use a nickname.
You can.
Can I use a nickname?
Sure.
I got a call from Dakota.
Okay.
Great guy. And, getting away from his addiction got him to where he could figure out exactly what his pain producer was. And eliminating most of that looks like a big game changer for this guy. And he's, doing well, which is nice to hear.
Obviously your bedside manner is second to none. And so those things are really wonderful to have. But it's not just sheer recovery. This is something that could be available in your communities. I don't know how many professionals are using the SCA technique, but
for drug addiction, you're looking at it.
Okay.
There are two, Dr. Dan Fry and myself. As soon as our funding is done and our next phase of research is out, we will likely publish what we're doing.
Right.
And then you will see clinics, and we'll go out to more recovery centers. It's a function of time. I'm a full-time treating doctor. Mm-hmm. I treat patients 35 hours a week in my office. Right. I treat people 6 more hours a week in your office. Right. And I treat people elsewhere for about 4 hours a week. Yeah. And that's about all the hours are left in the day for treating and still getting some of the paperwork done.
Well, you got wife and kids and stuff that I especially
sure, I see them every so often. Right. But that is in the works. Right. That as soon as we are done with this last phase of research, the probability is that we'll be bringing in quite a few people to go out and put these into clinics and then have a really large database, which is my biggest goal. Like I said, I got addicted to the pleasure of helping people in this particular manner with a gentleman who was a lifelong addict, gangbanger, LA guy, did absolutely phenomenally in recovery. I've literally never seen anyone turn into such a leader in recovery and help others so quickly. And then about a month later, he drove his entire family down from LA to introduce them to me. Huh. And they just, I didn't have any idea about it. Mm-hmm. And they just showed up at my office and his wife just wanted to meet me and hug me. And I thought, this is really unbelievably cool.
Right.
And I get why you guys do everything you do. And I know Sheer is one of the companies that does a lot of good out there, and they outreach to people who I think a lot of people wouldn't take care of.
Right.
I get why, because it is, it's extremely addictive from a provider standpoint to be able to take people from the really very low point that they're at and be part of the process. Even for me, you guys really are the process of bringing them up and getting them back to the world.
Those successes outweigh so much because you do see, there's failure and 9 times out of 10, 99 times out of 100, it's the individual base. It was their willingness, it was their lack of commitment that didn't get them to a certain point. But those that are serious about recovery, that want to get better, and especially if they're choosing help, to give them every opportunity to succeed the first time and do it right one time, those are the ones that really, really, it takes, anytime someone gets sober, good things happen,
Absolutely. I see, it's funny, when I'm in there and I meet initially with a group that's come out of detox, I can look at the people who are going to participate with us because they're choosing to take extra steps.
Yep.
They want every opportunity. And the guys and girls who are just ignoring me when I talk, and there are those who do, I feel for them. I want to reach out to them. I kind of want to grab them and shake them, but I'm not allowed to do that. So
infinite patience.
Infinite patience. I want to say, hey, pay attention. Do everything you can while you're here. But that's got to be the person's choice. And ultimately, this does start with choice and finish with choice.
100%. And we never give up before the miracle. So you just don't know when that light bulb's going to come on. And it's not always the first, before you get here, it's not always the first day out of detox. But you've also had a chance to see some of those down the road that turn around and you keep saying, hey, participate, listen. And then those that do, you just know they're going to be okay. Doc is a special chiropractor. I've had a lot of personal experience until meeting Dr. Fox. He's helped me with slip discs, with my shoulder, with so many things that I'm a shoulder replacement candidate. I don't want to have a new shoulder. I mean, it's a serious thing. And to have any relief and not have to use narcotics or anything to deal with pain has been really a sea change. So we're super excited to have you on the show, participating in our recovery center personally, but making yourself available and just allowing our audience to understand what resources are out there are huge. Can you tell our clients maybe where you're located? How do they find you if they're interested in this type of thing?
Well, if they want more information, you can always reach out to us through our website, docfox.org. Pretty simple.
Yeah.
And if you're in the local area, you can call us.
Yeah.
We answer the phone, 949-489-BACK. That's 2225.
Okay.
Yeah, we're chiropractors. So that's how you reach us. We're in San Juan and usually readily available to talk to people. However, I would say encourage anyone who's in recovery, understanding that besides myself, adjusting the spine to get your body in a state of homeostasis, like Anthony was saying, and to get you out of pain is going to be a helpful tool. It's a really, really easy thing to do. Working with a physical therapist to strengthen muscles and stretch, get elongation, get going in your body, moving around. I love that Cheer has a commitment to getting people active. I think that having physical activity is one of the big tools that most recovery centers should be using at this stage of the game. They should be understanding that the physical side goes in with the mental, psychological side, which goes in with the neurochemical side, and it all loops together.
It all adds up. And, you got to find opportunity, even in tough times. We're always looking for that in recovery, especially how can we make a bad situation better, or how can we improve on a situation? Well, we've got this global pandemic. We can't do all of the things. We can't attend outside 12-step meetings. We can't just go to the beach or park, even in small groups, without being super cautious and masks and gloves, et cetera. There's a question that's on a lot of people's minds. I'm sure several in our audience are wondering about how addiction could happen to them, because it's one of those things that if you don't have a personal experience or you haven't really seen it with your family directly, it can come out of nowhere, and we're all susceptible. So it's simple as a back injury, and now you're in pain management, and you've got a doctor handing you a handful of meds. Is this a common approach where you have people saying, I'm not an addict, I just have a back problem? Like, what do you see in that type of situation?
Well, as a chiropractor, this is really one of the things that I have a tough time with. We see this all the time. This is when you end up with your housewife, manager of a company who's never had any addictive issue in their life. They've always been right on the ball, doing the things they're supposed to do, and they have an injury. It can be a crown. It can be a dental impaction issue. It can be a spine surgery. It can be a bad disc injury. And instead of managing the medication and working through the physical elements, and this has changed. I think people have backed off of this quite a bit in orthopedics in particular that I see a lot of. They are trying to be more, get away from that, give them a pile of pills and just let them have them.
Good.
But every so often we still see that happening, or some people are just addictive personalities and you give them some and bam, they're gone already.
Right.
And then they get prescribed by the docs for a period of time. We see people stop the docs then cut them off cold turkey. Oh, time to be done now.
Yeah.
And they're addicted.
Yeah.
So they spend their own money and they buy street drugs, but they're buying street pills, the same pills they previously had, which are very expensive, non-prescribed. And then they kind of run out of that program and they realize, oh, I'm going to go visit my friend who just had surgery. Mm-hmm. And then they're in a medicine cabinet and they're going to take one or two, but that ends up half a bottle. Mm-hmm. Or they go see grandma, and grandma's got a medicine cabinet full of drugs.
Right.
And they go seeking that out. And then at some point that kind of runs out. And you'll see some people end up, I've seen middle-aged women, just housewives, breaking in and entering.
Right. Doing things they'd never do.
Things they would never think of doing.
Right.
And then they just change their MO. And then they run out of that phase. And that's when street drugs become an issue. And then you see heroin is usually where they end up these days.
It's cheaper and sometimes even more readily available if you can't get it from your doctor. And it's that slippery slope. However you end up on the path, it's the same. It was a choice that you made, good, bad, or otherwise, that led to a certain problem.
But sometimes you also see that issue where you weren't really given instruction that, hey, these meds are to help you barely get through this moment. Now go fix the underlying problem.
Right.
These are cover tools. I mean, pain meds cover pain.
Right.
They don't fix anything. And so doctors got very dependent on them as a tool for some, and I don't really understand it. About 20 years ago, we as a society decided that pain couldn't exist at all. It had to be wiped out instantaneously, covered up. Pain's there for a reason. It signals your body that something is wrong. It helps you identify what's wrong. And it gives you guidance as to what the tools are to correct it. So just treating pain for pain, sometimes it is necessary, but it became very overused in our society. And I think that's what led to this narcotics crisis, opiate crisis that we've got going on currently.
Well, I would encourage anyone. We get this call a lot where, hey, I've been in an accident. I've got terrible pain. Even if I have no problem stopping. Of course, there's always I can stop at any time. I don't have a problem with detox. It's not really drugs. But if I do that, I'm going to be in unbearable pain. It's a very, very minute part of the population, but there are those injuries where it's not pretty. However, you've got to give yourself that opportunity. If you're 40, you're 50, you're any age, and you're hooked on these pills, let's take a shot at something without the pills and see if it works. Because if you're just resigned to taking those pills, I'll tell you now, when nothing changes, nothing changes. You're 20, you're going to be 40, still taking pills, still in pain, because you've not tried an alternative.
Well, one of the interesting twists of taking the medications is they actually sensitize you to pain.
Huh.
So,
how does that work?
Well, your brain's every input of pain has been shut out or closed off or changed. So now if you get even the slightest bit of pain, your brain goes, wow, pain, and it's super elevated.
Yeah.
So instead of, after a while, them shutting pain down, they make you even more sensitive to what would be a small pain to you or me is this huge sensation in your brain.
Right.
Just not getting that sensation.
Right. Well, it's good to know that there are some solutions. And I don't think many of us look for the solution. We're so stuck in the, oh, pour me another drink type of mentality that it really takes a recovery mentality and being aware that there's people out there to help you. You're not alone. And it literally just takes picking up the phone or taking action, calling Dr. Fox, doing something about your injury or your pain issue that doesn't involve buying street drugs, hanging out in places you wouldn't be. Gosh, I've seen a lot in recovery, and it doesn't surprise me at all.
I've heard a lot of stories, and they were shocking.
Yeah.
So that's where it is.
If you're someone who's looking for recovery and you want to find all the tools to help you, well, there's Sheer Recovery, but there's a lot of centers out there all across the country. It doesn't have to be Sheer Recovery, but you should be looking at these things. Maybe you just go see a chiropractor on your own. You start getting involved. You find a local center, and ask, hey, do you guys have a chiropractor there? You ever heard of SCA? Are these things that are available to me to help me in the process, expedite it, speed it up, get back to my family, get back to my loved ones? You know, the world doesn't stop spinning when you go to rehab, right? So it's a period of time you really want to invest in yourself, whether it's 30 days, 90 days, 6 months, whatever it is. You want to take that block of time, throw the kitchen sink at it and everything else, and recover, get better, and get back to your life, get your life back, and maybe come visit Dr. Fox and thank him later, that type of thing, right?
Absolutely. Everything, every tool that's out there that we know has a reasonable chance of helping is a good idea.
Well, thank you, Doc, for visiting us today. Your expertise in the industry is well respected. I think our audience probably appreciated learning some tools and some avenues that they could take that maybe they haven't tried in the past. Can you tell our audience where your office is located, how they can follow you, how they can find you?
Sure, Anthony. It was a pleasure being here. And like I said, happy to come back. Maybe we'll bring a device, show you some of the actual electrical phenomenon, how it looks, how it works on the patient even. Our office is in San Juan Capistrano, California. You can always outreach me at docfox.org, or you can call 949-489-BACK.
Nice. That's easy enough. Thank you so much for joining the show. Again, iHeart, Spotify, and YouTube. So whenever and whatever's easiest for you, tune in. We'll have new information coming to you all the time.